Good afternoon for me here in Tucson, Arizona. It could be good morning for some other folk, and it could be good evening for some of my colleagues that are in DC, the beginning of evening. I would like to welcome you to our digital forum for the House Committee on Natural Resources. Today's forum is on the COVID-19 response in the U.S. territories. We are here virtually with panelists from all of the territories to hear about the virus response in American Samoa, the Commonwealth of Northern Mariana Islands, Guam, Puerto Rico, and U.S. Virgin Islands. More importantly, we want to receive the perspective about how Congress can help local governments adequately address this world pandemic. It's not just, and for the territories, it's even, I think they have a better understanding when we say world pandemic as opposed to just trying to keep it to the mainland here, the discussion. The territories face unique challenges based on geographic location, the unequal treatment under federal programs, and the dire financial situation. And so the islands having been hit, and the territories have been hit by severe natural disasters, including hurricanes, typhoons, earthquakes, and now further weakening the healthcare infrastructure and the economies is COVID-19. So local governments have been working to recover, and communities and rebuild under these events. But I believe there's more that needs to be done, and that merely one of the things that this virus has provided all of us, and I hope it provided everyone in Congress, is a perspective that as you go through and talk about recovery and relief, that there's a cumulative effect. When there has not been enough resources to a territory in this instance, as part of the history, suddenly you're drowned economically and in terms of health response with this very deadly virus. And so it becomes a cumulative effect of disparity at the beginning, and then you put disparity on top, and you demand a response that is already taxing local communities and local governments. So I welcome this discussion. I think it's important. I'm going to thank my colleagues, Mr. Sablan, who is vice chair of the full committee and insular affairs in particular. Mr. San Nicolas, welcome, and thank you very much for joining us as well. Their advocacy and their insistence on equity and full attention to the territories has been very, very necessary and essential, so that when we respond to this pandemic or any other issue at a federal level, that there is inclusion. And these two gentlemen have been very, very effective at assuring there's inclusion for not only the areas they represent, but the totality of the insular territories under the jurisdiction of our committee. So I want to welcome the panelists to this format and introduce them each as we go along. But before I do, since they're with us, let me ask the vice chair if he has any opening comments before I introduce our panelists, and if there is any of the panelists in particular that you would like to introduce yourself. Mr. Sablan, the time is yours.
Thank you, Chairman Grijava, for holding this, and thank you everyone for taking part of this. I want to thank all the staff who are in the background putting this all together, weaving the thread together. So good evening for those of us who are in DC. Good afternoon to Chairman Grijava and the Caribbean. Good evening as well. And good morning to those of you in the Pacific. And thank you again to the participants for being in today. Welcome. I'm thankful we'll be hearing directly from those of you in the separate territories, individuals on the ground with a clear knowledge of the local situation and the respective challenges and needs. And from the Northern Mariana Islands, we will hear from Ms. Esther Munya, no no stranger to the committee, who is CEO of the Commonwealth Healthcare Corporation. I couldn't think of no one better to hear from about the emergency response in the Northern Mariana Islands. And of course, nearly all the territories have been, like Chairman Grijalva said, recovering from the damages of severe natural disasters before this pandemic hit our shores. The hurricanes, the earthquakes in the Caribbean, super typhoons and cyclones in the Pacific have had a devastating impact on individuals' lives, on public infrastructure, on our economies. And Congress has already provided billions of dollars for the recovery, and we were slowly starting to rebuild. And then COVID-19 pandemic started to spread throughout the world, the globe. This public health disaster is unprecedented for the whole world as a world community, and for each one of us individually. The economies of every state and territory have been devastated. The fallout will surely be felt for years to come. And even before this public health crisis, the economy of the Northern Marianas was reeling, attributable no part to typhoons Yutu and Mangkut in 2018, but since the outbreak, businesses have shuttered, residents lost their jobs, public school teachers have been furloughed, pension payments have been reduced, and the harm felt throughout the islands continued to mount. So I would say that initially the Commonwealth was slow to recognize the severity, but since have done a commendable job at keeping the virus at bay. The number of positive cases, 14, has remained at 14, and we've unfortunately had 2 deaths. Both were citizens and residents of the Philippines who were missionaries and on a mission work to Saipan and Tinian. And the measures I set in place are working: the suspension of flights, the quarantine, the shutdown measures, stay-at-home orders, public education on the need for hand washing, and so also all seems to be working. And I really pray that that continues. Congress, FEMA, HHS, DOD, Interior, and a host of other federal agencies have provided critical assistance. We want to ensure that continues to find out if more is needed. To Mr. Nicolas and Mike especially, and well, to the Virgin Islands and American Samoa, we're really having a difficult problem with Department of Education trying to get them to release the Education Stabilization Fund. We got notice yesterday. They withdrew that notice from public view today, and just but we're trying everything. So it's way overdue for our schools. But thank you, and thank you again, everyone, for joining us.
Any comments on introducing one of the guests that from the district you represent? Wow.
Thank you so much, Mr. Chairman, again, for your leadership and for your constant vigilance in looking out for our territories that fall under the jurisdiction of the Natural Resources Committee. I want to also thank my colleague, Philili Sablan, for his leadership and his mentorship in making sure that the Pacific territories in particular, but all the territories in general, are constantly being looked out for in the responsibilities that we carry as members of the Natural Resources Committee. Mr. Chairman, I was really moved by your opening statement because it was very profound, and it represented a profound insight of the circumstances in the territories, and particularly how those circumstances become exacerbated when we face challenges like these. And I wanted to take this opportunity to kind of share how those pre-existing challenges are circumstances that have become exacerbated in the most un-American way. And this issue I wanted to kind of bring to the attention of this particular panel is supplemental security income. And the recent case in Puerto Rico, the circumstances in Guam, we do not have supplemental security income in most of our territories. The Commonwealth of the Northern Marianas was wise enough to negotiate receiving it when they negotiated their Commonwealth relationship with the United States. But unfortunately, the rest of the territories do not have it. And the absence of supplemental security income means that those at-risk groups weren't already receiving the most basic level of American decency in terms of support. And as a result of not receiving that support, they've been relying on caregivers and family members being able to supplement their needs. And in these circumstances, those brave caregivers and family members who have been working extra hard to care for those who need their help, they're out of work. Their job prospects are unknown. And we now have a community of individuals who not only lack supplemental security income, but they even lack the support of those who were taking care of them previously. And so they've gone from not being supported to downright destitute. And so as we move forward with these CARES packages, and as we look for ways to try and preserve the American way of life and the decency that we hold true to in this country, I believe that this is an opportunity for us to not only address the challenges that are being faced as a result of this pandemic, but to have a very keen understanding now of how leaving out our people in the territories on things as basic as SSI is just unacceptable. And so we have an opportunity to not only address these challenges today, but to circle back and to correct these injustices that are today are just absolutely horrific for those that are being impacted. And so I wanted to thank you, Mr. Chairman, for affording us the opportunity to be able to vocalize what we're going through. I wanted to recognize Dr. Tom Shea, who has been a very, very vocal advocate for the necessary procedures and equipment and just a real good general view of the severity of what we're going through on Guam and the necessary advocacy that our people have had to take on themselves in order to be able to fill the gaps that our people are facing on a daily basis. Thank you so much, Mr. Chairman, and I yield back.
Thank you very much. And let me begin with our first panelist and collectively thank each and every one of you for taking the time, for bringing the perspective, to continuing to prioritize what the territories not only need, but are justified in demanding that they get. And with that, let me introduce, well, I don't need to introduce, Mr. Sablan did that, Ms. Esther Muña, Chief Executive Officer of the Commonwealth of the Northern Mariana Islands Healthcare Corporation. Ms. Muña, the time is yours.
Thank you, Chairman Grijalva, Vice Chairman Kilili Sablan, and distinguished committee members. Last May, I gave testimony to this committee under very different circumstances. I presented to you the powerful, positive impact of equitable Medicaid funding on our healthcare system. Last December, the federal government took us to task by granting 2 more years of equitable Medicaid funding for the territories. But only a couple of months later, the CHCC was introduced to its greatest challenge yet, the coronavirus. In January, the CHCC began messaging coronavirus prevention in our community and screening patients for symptoms. In early February, we sent our first specimen for coronavirus testing nearly 8,000 miles away to Atlanta. It took 10 days to receive a negative result. Over the next month, we took steps to reduce traffic on our campus, incorporated coronavirus screening into our regular disease surveillance at the Saipan International Airport. On March 16th, we activated our Area Operations Command, diverting nearly a third of our staff to the response. On March 28th, the CNMI announced its first 2 positive cases, with 12 more cases confirmed since then. In the past 40 days, with support from our governor, his task force, and CHCC staff, we have screened more than 500 walk-in patients for coronavirus symptoms, screened more than 1,500 passengers at the airport, identified and interviewed more than 215 contacts of positive cases, responded to more than 700 phone calls about the coronavirus, overseen the care and release of more than 250 individuals from quarantine and isolation, had more than 300 specimens tested, including more than 200 at our own lab, and conducted more than 90 teleconsults with our patients. 3 days ago, the CNMI began conducting community-based testing and have collected samples of more than 400 people. Of the 14 cases confirmed, 2 have died. and the other 12 have recovered. It has been nearly 2 weeks since our most recent case was identified. We have been vigilant, we have been effective, but we are still vulnerable. The CNMI is uniquely susceptible to upheaval should we experience a larger outbreak. The virus undercuts the power of our social capital, built on family gatherings, multi-generational households, and close relationships with our manamko. It lays bare our non-communicable disease crisis and threatens to tear away the gains we have made to our healthcare system. It has evaporated our livelihood, throwing our tourism-based economy into swift and acrimonious decline. The CNMI government is shut down and is projecting a $65 million deficit. The island schools closed, many public and private employees have been furloughed, skyrocketing unemployment, the retiree pensions cut 25%, rendering healthcare unaffordable for so many families. The CHCC's success thus far is a result of a Herculean effort requiring nearly 18,000 staff hours and over $7 million. Thanks to the governor, the support from the governor, and the COVID-19 task force, and the federal partnership of HHS and DoD through FEMA, and further supported by the CARES Act, we have been able to secure additional ventilators, PPE, laboratory equipment, testing reagents, establish a temporary 40-bed care site, and a longer-term alternate care site. We have received help to assess our surge staffing needs and develop a territorial action plan. We can now test for the coronavirus on island, an ability that felt far from our reach just 1 month ago. This assistance has been core to our success, but we do need continued federal assistance to put an end to this war. We at the CHCC must fulfill our regular obligations while balancing the coronavirus response and forging an ambiguous future to prepare for the worst. Our strengths and our weaknesses are brought into focus, while the disruption has sparked innovation and illuminated opportunities for improvement. We are in ample supply of vision and determination, but we need your help to establish a reliable, equitable supply chain for PPE and testing reagents. We need funding to keep our staff, including our robust contact tracing team at work. We need support for the long overdue expansion and modernization of our 35-year-old hospital. Along with our governor, his cabinet and task force, and Congressman Sablan, we are working hard to safely bring the rest of the CNMI back to work. Help us get there. Thank you, Jesús Maasi and Olamwai.
Thank you very much. Thank you, appreciate it. Let me introduce Dr. Sher. Sir, the floor is yours.
Thank you. Thank you, Mr. Chairman, Vice Chair, and our Congressman Michael St. Nicolas, and all other panelists in this meeting. I have to say I don't work for the government, and I'm independent, and I will speak frankly as a person that's on the ground. You know, Guam is small, but we're considered for the military in the United States as the tip of the spear. This is where America did begin, and right now it's about just past 8 o'clock in the morning, and we are trying to adjust our living standards for the people here because people are out of jobs and many are suffering. But COVID-19 has hit Guam pretty hard. It's unexpected. The sad part about our first case is that from the very first case, our island was already acquired the virus from the community. So the evidence of community spread was already there. So far, we've been lucky. We only have 5 deaths thus far. Sadly, they're part of the family of, you know, Guam is very compassionate. So, you know, even if it's just 5 deaths, you know, it affects a lot of people, including 1 death from the United States Theodore Roosevelt, which is aircraft carrier. So that's hit Guam pretty hard. The island total right now, it's about 145 positive, and we've tested about 1,200 thus far. The US Navy positive is approximately 1,000, and I commend the United States Navy for being able to test 5,000 sailors within just a 2-week time frame. You know, I did also write to the Admiral, congratulating him on that task. It's not an easy task. And we actually asked him that as the sailors return to the ships, perhaps time has come for the U.S. Navy to actually help us with the testing capacity, supplies, and personnel. And I'm hoping that, I'll get a positive response. The community of Guam has really always been good with the military, and that cannot be forgotten as you take our voice to Congress, to the House, to Congress, and to the President of the United States. To be transparent, the projection coming from the governor's office here has been way off course. The projected 3,000 to 6,000 deaths and over 400 hospitalized COVID-19 patients, are or more by now is just not happening. Luckily, I think our hospitalization rate has been really flat, so that's good. I keep saying that there's really no model to compare Guam to New York City, to Wuhan, to Korea, or to Japan. Our population, 160,000, compared to other places that's over 8 million people, such as New York City. That being said, though, we can't take this virus lightly. Guam is trying to add another, I think the projection from the governor's office is trying to add another 2,000 beds to the island. Seriously, it's like building a restaurant with 2,000 seating capacity, but you only have 100 waiters and 10 cooks. There's just enough medical staff for doctors and nurses to staff 2,000 additional beds. And this is just to show you that the lack of medical staff is part of a big healthcare disparity that our island is experiencing. So that said, I'm glad that Guam has already received $128 million in federal aid. And I really like our government to be really transparent in showing that the people where this dollar is being spent. The money should be directed to people first, and we ask our government to be transparent on that. And over this last few months, our people really have suffered a sacrifice, lost their jobs. Money for their families, losing their healthcare insurance is so critical during this time. But the people really want to get back to work. Just to give you a perfect example, I had a patient that was pregnant and she had 4 children. Her and her husband both work, but right now they're being furloughed and no income's coming in. They have some savings, but over the last month and a half, they really dug into their savings and they have a hard time paying their bills. And not to mention that, they even have a hard time trying to buy cereal and milk for their kids. So I gave them $100 to go buy food just the other day. These are the hardworking people that are suffering. And this is just one case, and I'm sure there's hundreds of them, or even thousands of them out there. The stimulus checks, I think it's going to help, but it's not enough. I think our people cannot continue to be living under this emergency declarations. I think they want to get back to work. They've stayed home, they're social distance, they did put on their mask. And I think we have started this virus within our community enough that the key right now is to engage the community in how to reopen to a new normal. Guam is small, and we cannot and should not be forgotten by the United States of America. If we do not get our working force back, we're really going to head into economic recession, and it will affect the healthcare of our people as well. Social distancing, hand washing, face masks, it's a new normal. So we ask the federal government to help us with funding, but at the same time, I think we really ask our government to be transparent on where every dollar is spent. And that dollar should be spent for the people of Guam. Thank you.
You're welcome, sir. Let me introduce the next panelist, someone I know and have worked with, Federico de Jesús, Senior Policy Advisor for Power 4 Puerto Rico. Been working on the issues affecting the island, and again, I think we'll speak to that cumulative effect as we go forward, as the other 2 panelists have spoken as well. And Mr. de Jesús, time is yours.
Muchas gracias. Good afternoon. My name is Federico de Jesús. I'm a Senior Policy Advisor for Power for Puerto Rico. It's an honor to be here with you today. Thank you, Chairman Grijalva, Vice Chair Camacho, Sablan, and Congressman San Nicolas for inviting me to share our thoughts and concerns about the COVID-19 pandemic as it affects the Commonwealth of Puerto Rico. And obviously, thank you to the committee staff and to my fellow panelists. Unfortunately, not everybody has the luxury of spending time at home working with food and other comforts. Though this has been a taxing time for everyone around the world, it is important to understand that the U.S. territories and Puerto Rico in particular come to this global struggle with 2 hands tied behind our backs. The coronavirus outbreak is the 3rd straight natural disaster to hit our island since 2017, together with the man-made disasters of the botched federal hurricane response, as well as the fiscal crisis and economic depression afflicting Puerto Rico for the last 15 years. The pandemic has once again revealed What has been obvious for a long time, Puerto Rico cannot effectively address the challenges of the COVID crisis or rebuild in a sustainable way while being hamstrung by federal restrictions resulting from more than 120 years of U.S. colonial rule. The fact that we are holding this hearing in the Natural Resources Committee as if our people were akin to a national park or a natural gas pipeline is denigrating for both Puerto Rico and the United States. In 1898, the U.S. General Nelson E. Miles, who arrived in San Juan, he promised to, quote, bestow to the people of this beautiful island the greatest amount of liberty compatible with its military occupation. 122 years later, those words ring as hollow and contradictory as ever before. But why is this important? And how can this committee effectively redress many of the grievances in the short term while effectively fighting the pandemic and also addressing medium and long-term challenges? It will become apparent as I go along. But first of all, what's the situation on the ground? Today, 1,433 people have tested positive for COVID-19. 86 have unfortunately died, and approximately 30,000 tests have been conducted. This in an island of 3.2 million US citizens. So what explains the lack of testing? First off, the Trump administration, as several of you know, has refused to implement a national testing strategy and has not properly invoked the Defense Production Act. So state and local governments have been placed in this Hunger Games type of situation, competing against each other and the federal government in the global market for tests. Also, the government of Puerto Rico entered into a questionable contract for 1 million COVID tests that never arrived. Since Puerto Rico has had 3 health secretaries, the state epidemiologist resigned, and the current secretary, though very forthcoming and professional, has admitted mistakes in the counting methodology. Though the Commonwealth legislature is investigating the scandal, the reality is that no other contract has been signed to get a significant number of tests to the island. Puerto Rico has also barely begun addressing the earthquakes that rocked the island in December and January that left thousands homeless. In fact, we have never started to really rebuild after the hurricanes Irma and Maria hit in 2017. And there are still tens of thousands of homes with plastic blue tarps instead of roofs. Why is this the case? Well, because as has been widely reported, $20 billion that Congress approved to rebuild Puerto Rico, HUD has only sent $1.5 billion to the island. Unfortunately, Puerto Rico has only spent a fraction of that money, $30 million according to HUD. This committee and Congress as a whole have a responsibility to investigate and shine a very bright light on both the federal funding delays as well as the government of the island for not spending the money intended for the people. This brings me to a painful issue about school lunches. As all of you know, Congress has appropriated funding for schools to be able to continue providing meals for needy students and their families, and that would be paid for 100% by the federal government. Unfortunately, Puerto Rico's governor instead has sent some food, many of it expired according to local reports, to nonprofits that serve the population at large, not necessarily needy children, which is the intent of the law. Leaders of all island political parties, which are different than the ones in the United States, have demanded the governor open school lunch kitchens and has refused to open the school lunch counters. Congress needs to immediately compel the Puerto Rico Department of Education to open the school kitchens now. What other policies are needed? And I'll be brief for the interest of time. We need to restore federal tax incentives for U.S. manufacturing. Section 936 and Congress eliminating it really got Puerto Rico into the recession that we're in now. But this is also a national problem. Puerto Rico could serve as another gateway for the U.S. to manufacture and also boost national security, manufacturing pharmaceutical and medical materials, 80% of which are now made in China and could return to U.S. shores if these tax incentives are restored. We need to cancel the debt. Puerto Rico has $72 billion in debt, and thankfully this committee has supported the Territorial Relief Act, which would reduce that debt. And we also need Congress to mandate that the Fiscal Control Board that it created under Promesa set aside $9 billion to pay Wall Street. We need that money to be reprogrammed to help the people. We also need to pass the earthquake supplemental. We need to get rid of the Jones Act, as many of you on this call know. It taxes $1.5 billion to Puerto Rican consumers every year. There are several technical fixes for the SBA and Family Leave Act. Basically, 501c3 organizations are treated as small businesses under the CARES Act. But in Puerto Rico, most nonprofits aren't registered with the IRS. They're registered with the Commonwealth State Department. So we need a fix so that state and territorial governing entities that have certified these charities also get the benefits. And in the Family Paid Sick Leave Act, we obviously got paid sick leave for our workers, but unfortunately the U.S. Department of Labor is saying that that will only start on April 1st. But in the case of the island, Puerto Rico locked down on March 15th. And let me just commend the governor because this was the first and the strictest lockdown. In fact, it also included a curfew, a toque de queda, they do in Latin America, to prohibit people from leaving their house at all at night. But while that was commendable, unfortunately, there's much more to do. I really want to close by saying that we need to lift the Medicaid cap. Puerto Rico, as other territories here, face an artificial and arbitrary cap to the Medicaid funding that we need. And obviously, dealing with a pandemic is no way, capping Medicaid funding is no way to deal with a pandemic. So in conclusion, it is self-evident that most of these issues fall under the square purview of Congress and the federal executive branch. Puerto Rico will really never recover or thrive unless these arbitrary colonial restrictions are lifted. That is why Chairman Grijalva's Promesa Amendments Bill, which addresses debt relief and some of our other concerns, is such an important first step. We look forward to that discussion so that the harmful effects of Promesa can be reduced and the law eventually repealed, and for Congress to finally uphold its moral, democratic, and humanitarian obligation to decolonize all of its territories and Puerto Rico. Muchas gracias. Thank you.
Very much. Our next panelist is Ms. Justa Encarnacion, Commissioner for the U.S. Virgin Islands, Department of Health. Ms. Encarnacion, thank you for joining us today. I'm sure you're extremely busy during this crisis and appreciate your valuable time. And please, the time is yours.
Thank you very much. Good evening, Chairman Raul Grijalva, Ranking Member Rob Bishop, and other members of the committee. I would also like to acknowledge a Virgin Islands Congressional Delegate, Congresswoman Stacey Plaskett. We welcome the opportunity to inform the committee and the Congress on the Virgin Islands response to COVID-19 pandemic. As of today, we have tested 872 persons, 732 negative, 62 being positive with 78 pending test results. Of the 62 positives, 51 have recovered, leaving only 7 active cases. Sadly, we experienced 4 deaths. After the first case was confirmed in the mainland United States, the Department of Health assumed incident command and activated its virtual emergency operations center on February 2nd. As Commissioner and Incident Commander, I conveyed the first of weekly interagency assessments and planning meetings on February 7th. On February 21st, the Department of Health collaborated with the Virgin Islands Territorial Emergency Management Agency, or VITEMA, to conduct a tabletop exercise that over 65 agencies attended. We identified our strengths and several gaps that served as a building block for our goals and strategies in the department's EOC. Our interagency meetings continue daily under VITEMA, which was sparked by the Governor Albert A. Bryan Jr.'s declaration of the state of emergency on March 13th, the day of our first confirmed positive case of coronavirus. Like everyone else, we suffered from lack of sampling and testing supplies and equipment and personal protective equipment. But we are proud to say, with a strong epidemiology team and prudent tracking and contact tracing methods, we have tested all of those who have reported symptoms and concern related to COVID-19 and monitored those quarantined daily. The Division of Epidemiology worked with members of CDC and created a model for COVID-19. The model predicted over 100 hospitalized patients, over 300 deaths, and thousands of needing outpatient respiratory supportive care. Due to a recovering infrastructure resulting from the 2019 Category 5 hurricanes, the bed capacity within both districts is incapable of meeting the projected surge. In addition to the limited bed capacity comes a lack of staff and equipment and supplies, but both hospitals report a total of 14 ventilators. Epidemiology has established that due to our mitigation efforts, the VI is below and behind our expected peak. We are thankful for that. Recognizing this, our efforts have been keenly focused on providing and preparing the facilities, beds, repositioning and recruiting staff, and ordering needed supplies and equipment through FEMA, HHS, and commercial entities. Due to their efforts, unfortunately, so placed on the states under Region 2, our requests were either denied or placed on hold. As we meet, the Army Corps of Engineers and contractors are preparing the VI National Guard's Regional Training Institute to become an inpatient facility on St. Croix. An unused floor in Snyder Regional Medical Center in St. Thomas has been repaired, renovated, and equipped to provide overflow capacity. The work of USAIS and staff at RLS will yield a total of 100 additional acute care beds. Our first public health lab was provided provisional certification by CLIA, and as a result, we began COVID testing in mid-March. The lab continues to increase its testing capabilities. With most of our cases being travel-related, we have worked with the Virginia's National Guard to establish passenger screening at our airports and with other local agencies to include additional ports of entry. The Department of Health joins Governor Albert A. Bryan Jr. 3 times a week in press conferences that provide insight on data, trends, mitigation efforts. We utilize all venues to address the emotional impact of COVID-19 on our community, from the youngest to the oldest, with tips and resources for staying mentally healthy during this time. Virtual programs have also provided. We continue to expand. Most recently, our sound trucks carrying messages and our catchy jingles through our communities have actually been very encouraging. We have worked hard and it has paid off in garnering the support of ITEMA, FEMA, HHS, the Office of Interior, private donors, and others. We have enjoyed the unwavering support of the local administration. Governor Bryan, Lieutenant Governor Roach, the cabinet and staff, and our legislature has remained engaged and supportive as well. I will be remiss if I did not acknowledge the work of our own Congresswoman. Congresswoman Plaskett, as the VI was included within every funding stream and is simply by providing the support to both the Department of Health and hospitals. Thank you, Congresswoman Plaskett. We're also thankful to our DOA staff for their dedication to ensuring that our community receives the healthcare services that's needed and their flexibility. Like other fellow offshore areas, our particular vulnerabilities and distance from the mainland United States present unique challenges that we ask you to always keep in mind as you advocate and legislate on behalf of the entire nation. With God's blessing, COVID-19's roar will become a whimper. Even so, we know that this will not be the last disaster we will have to face. What we need from Congress is not just to support the response to this pandemic, but to ensure that we are better prepared for the future. We ask that you help us to strengthen public health and other critical infrastructure on which it depends. That includes building a strong workforce, addressing and improving the social determinants of health, and bringing equity to us, your fellow Americans, in terms of Medicare and Medicaid, as many of us have already stated, SSI, and other programs our residents actually need. We, as Virgin Islanders, have given a lot of our country in terms of lives, services, and other many varied contributions in every sector of American life. We are proud Americans. We ask for the tools that would allow us to continue to serve and enhance our service. Thank you for the invitation to testify, and I'm willing to answer any questions that you may have. Thank you.
Ms. Encarnacion, for the insight, the information, and some of your very pointed and necessary advice. Let me now introduce our final panelist, Ms. Sandra King Young, the Medicaid Director of American Samoa Government. Thank you again for joining us, Madam Director, and you may begin. The time is yours.
Thank you, Chairman Grijalva. Talofa to you and the committee and to my fellow colleagues from our sister territories. On behalf of Governor Lolo Matalasi Molinga and the people of American Samoa, thank you, Chairman Grijalva and Vice Chairman Sablan, for your leadership, and to the committee for all your support and work that you do for the territories. Joining me here today are 2 of our COVID task force team members, Dr. Ifili John Tufa, our territory's epidemiologist, Mr. James Famuina, Deputy Director of the Department of Human Resources, overseeing a lot of our first responders. Our government and our territory are operating under emergency COVID-19 declarations with oversight by the Governor's Corona Task Force made up of multiple government agencies. As you may know, we are grateful here in American Samoa that to date, our territory has no confirmed cases of coronavirus, but we continue to operate on high alert, executing emergency protective policies on the island. Our governor closed our borders from outside passenger travel on March 26, which was the last passenger flight to come to American Samoa. This border closure will continue through May 31st. Reopening our border will largely depend on readiness to accept passengers traveling from affected areas, particularly in our ability to test, which is going to be a problem if FEMA does not provide enough testing supplies to our territory, and an additional 50 ventilators in anticipation of reopening our borders. We tested 64 people and all 64 are negative. We have 1,200 tests on island to serve 56,000 people. Our territory only has 13 ventilators on island. Further, the chronic issue that Medicaid has in support of our healthcare system and providing timely services to our people is the local match. If there's anything that can be done to provide the territories with 100% FMAP during this pandemic, that would be extremely helpful. Two other key challenges that we are also facing is the difficulty of our small business owners receiving help from the SBA programs made available under the CARES law and the release of U.S. Department of Education funds based on our poverty levels for American Samoa. Our territory small businesses have to compete with all businesses across the country under a first-come, first-served basis. By the time our small businesses try to access SBA assistance, like the economic injury disaster assistance, all the funding was spent by the big states. We need a specific allocation, probably under SBA for the territories. Many of our small business owners don't have professional business plan writers to submit these applications. When one of our local banks was finally able to process payment protection applications, the very next day the program was closed. Although there is a new funding now for the care for the coronavirus, the SBA portal is not yet up and they are still processing previous applications. Many of the issues that are challenges for us have already been shared by my colleagues from the other territories, so I don't want to repeat those. I would like to yield my time back to the committee so that we can give more time for questions. Thank you again for the opportunity, and we're ready to take questions from the committee.
Thank you so much, and thank you for yielding the time. Before I turn to my two colleagues for the sake of let me just a couple of brief questions. Ms. Young, you talked about the obstacles. One of the things, and I think it's the process of saving lives costs money. We all know that, and you see some of the economic consequences of doing those very necessary and life-saving strategies and policies that went into place, both by your territorial government and by the federal government as well. But there's also the issue of capacity, and I wanted to ask you, in terms of capacity, where do you mentioned some of the obstacles that you're facing with regard to some federal agencies, and I appreciated the comprehensive way that the assistance to small business that didn't get there, and some other issues that the waiving the match at least till we have a clean bill of health regarding Medicaid and other issues, in a comprehensive way. The response has to happen to this recovery, and part of it is the issue of testing. Can you reflect on those obstacles and how you see them all kind of interconnected? Which I don't know what the question.
I'm so sorry, Chairman Grijava. We just got disconnected and I missed your whole question.
Let me tie it down real. What are the obstacles to America Samoa that America Samoa is facing regarding federal agencies? Number one. Number two, you mentioned small business, you mentioned Medicaid, others have mentioned education, how the health response and how these other issues are interrelated in terms of the overall recovery for any of the territories. It's open to anyone who wants to answer it.
Sure.
But let me begin with you, Ms. Young.
The testing is going to be a real issue for us as we prepare and anticipate reopening our borders probably sometime in the summer. We really cannot reopen our. Can you hear me? Can't reopen our borders unless we have sufficient testing supplies on island. And I'll turn over to my colleagues who can give more information on that.
Quickly though, because I want to make sure that the other people have opportunities.
No, I think I'm just echo
echo what Sandra was saying, that the main concern that we have right now, it took a while for us to get test capabilities here. And with a population of 56,000 people, 1,200 tests is not enough to, one, serve the intent of testing asymptomatic people to ascertain whether we have the virus or not. And if we want to open up our borders, we should be able to test those that are coming here to see if they are carrying the virus or not. We have 0 cases, and we want to maintain it that way. Thank you.
Sir?
Congressman, I'm sorry.
We're looking at the president's guidance for opening up our states and territories, and the governor is mindful that while the states are starting to pass their peak, American Samoa hasn't had that a positive case, and we're trying to take a progressive and aggressive effort, contrary to what our sister territories are going through. That we're still keeping production, as one of our biggest canneries are still operating to meet the president's demand for food security. And testing is paramount for us to be able to sustain our prevention and surveillance efforts when we decide to discuss probably the protocols for us to consider opening up our borders. And other questions, we yield the floor back to you, Chairman.
Thank you. And that same dilemma is in many places in the mainland as well, where there is, how do we open up? How do we phase it in? What are the indicators? And usually the complaint, not complaint, but the urgency on the other side is, do we have enough of a testing capacity and data to be able to talk or strategize or plan for what that opening up is and isn't? And I think the same concern you justifiably raised, and particularly in the situation in the territories, is even more pronounced than it is in the mainland. But the mainland's struggling with that question. How much, and have we had enough testing? I'm in Arizona. We're the lowest stated testing in the whole country. And as such, in the mainland, and as such, how do you talk about opening up? And I think your point about capacity is really, really well taken. I appreciate that. Mr. Sablan, if I may turn it over to you for any questions you may have, and then after that, Mr. San Nicolas, give you.
Thank you, Mr. Chairman. I'm going to ask just a yes or no answer to each one of you, and this is not a new issue, but I want you to know that the delegates have gotten together, and we have taken the lead, and we've sent letters to not just leadership. Chairman Grijalva has joined us on this as well. We've sent it to KPAC, we've sent it to CHC, we've sent it to committee chairs. We're trying to not just remove the FMAP up to the end of 2020. I think we're trying for 2021 right now. And of course, remove the cap permanently, the FMAP cap. The SSI issue, I have, since my first year here, I have sponsored bills. It is really unfair, and I'm just so thrilled with the court decision on the Puerto Rico case, because right now I use that in Chairman Congressman San Nicolas set up a phone call with IRS, and I said, hey, listen, isn't this similar to the Puerto Rico case where a person moves to Puerto Rico and they lose their SSI, and the Treasury is paying all SSI beneficiaries monthly, and now you're going to have to make the local government pay. It's just discriminatory. It's just so unfair. But so we are working together, trying to do the Medicaid thing, and the FMAP, and but let me also ask, Esther, let me ask that. Can you did allude to this, but let me say, have your experience been working and communicating with federal agencies such as FEMA, CDC, and Interior during this pandemic? How has that been?
Thank you, Congressman. The experience we have with FEMA is actually very supportive. There's always an ask of how to strategize, for example, our laboratory capacity. as I mentioned, we've been testing already, using the Abbott ID testing platform, and it's been, basically very supportive. There's one of the things that we've been asking for really is because, like you mentioned, without a strong healthcare system, with FMAP matching, not to, we needed to remove the cap to be able to strengthen our healthcare system and be responsive. And we have done so much already, in the beginning. But it's just necessary to continue the support, and I'm hoping that it will be continuous because of the need to have adequate staffing, adequate PPEs, and adequate, basically give us the armor to fight this. Because if we don't have that protective equipment, it's going to get worse. And as you alluded to earlier, with the chairman alluding to it, is that we have a sick population already. It's we need to be able to protect everyone. And Medicaid disparity, please remove that. Remove that disparity, because we really need to strengthen our healthcare system and ensure to empower our people, because we are very weak if we don't have a strong healthcare system. And I appreciate all you've done. And as I mentioned earlier, thank you for the opportunity to fix that. But we need better fix now, because now we're falling back behind again. So
Right.
Thank you, Chairman.
Thank you.
Vice Chair.
Yeah, and in among, in the thousands of programs, federal programs that apply to the states, a little over 700 apply to the territories. And even among that 700 mix, there are some that apply to just one territory and not the other. All kinds of mixture in there.
Yeah.
But we're gonna get there. It's gonna take some time. But listen, Miss Young, Sandra, if I may, did I hear one of your? I think it was either the medical doctor or the deputy director saying that the tuna cannery is operational.
Yes, let me turn that over to James. Yep, our deputy director.
Yes, our tuna plant is fully operational. We're trying to meet the increased demand from President Trump's call for manufacturing to meet our nation's food security. So the doctor Ifili next to me and the governor's task force for coronavirus built a task force to make sure that the StarKist, the cannery industry, had sufficient protocols in place to mitigate any spread of the virus prior to our border closures. So now that we've gone a good 2 or 3 weeks of border closures, we're comfortable to say that there is no coronavirus. We're trying to make sure that we sustain the production value. As far as the government's concerned, we've gone down to 50-50 level staffing, yet we're still paying the majority of the workforce as if they're all working a full 8 hours for the last few or 3 pay periods or 6 weeks.
Right.
Yeah. So American Samoa is still fighting. Yes.
Thank you. Just yesterday, I had a call from the FSM's ambassador to the United States, actually just updating me about how most of the Federated States of Micronesia's citizens who work in the processing plants, meat factories, animal farms, and are actually doing okay, not as bad as those plants are reported to be. So I was happy to hear that. Dr. Shea, let me let me admit my own guilt. I admit to my guilt of actually publicizing and representing what FEMA has given to me as in terms of the peak. The peak for the Marianas is going to be the end of May, early June, and there's going to be 3,000 to 6,000 people who are going to be infected. I don't know if Johns Hopkins is just completely wrong, or those models don't work in the islands, or actually maybe because we are able to control and close our borders and said but we're doing something right. I think I am very happy that I'm wrong, that Johns Hopkins is wrong. I hope they don't make a mistake when they diagnose me, but otherwise. But
Go ahead. You can ask a question.
FEMA.
Yeah, I think if I could thank you for your time, first of all, Vice Chairman. I think the projections that based out of the state side are actually models based on big cities. You know, Guam, as you know, is a flat island, and our population is 160,000. And communication with our people is actually not that difficult to reach. So I think our community has responded. Our doctors took out, just to let you know, that our doctors, almost every single one of our community doctors, actually reached out to the people, to our patients, and we took out PSAs. We took out the media has really helped us to carry those PSAs for free to the people to stay home, wash their hands. And, you know, the patients community listen to their doctors. We have thousands of patients that come to see us every month, you know, combining all our clinics. So they do. So I encourage all the territories to use their community doctors and reach out to the patients and say, hey, this is a crisis, stay home. And I think that's worked for our community. So they rather listen to your doctors, personal doctors, to do that. As far as the projections go, I don't see FEMA's projection as being correct. And I think what their projection is a worst case scenario, but you know, you have to be realistic. You don't set up policy based on tabletop exercises. I think you have to look at numbers, the uniqueness of each of our territories. And that's very important. Transparency is always very important.
And so I admit my own, and just one more thing, if I may, and I forgot what it is. I have a senior moment here. So I will yield for now, Mr. Chairman. Thank you.
Thank you. Well, let me, before I ask Mr. San Nicolas, if I may go back to Dr. Sheh, which begs the question in your last response.
Yeah.
At what point, if the tabletop based on urban areas is not applicable, and I wouldn't disagree with you, to let's say to the territories and in particular to the point that you're making, then what level of data, testing, whatever we want to call it, would be sufficient to say we're ready? We have a kind of clean bill of health, for lack of a better phrase.
Well, I think we should always be prepared. We gotta always be prepared. I mean, as the islands, territorially, we're CNMI is the same situation. We don't have towering buildings, and the projection that they're giving us, we have already proven that to be wrong over the last couple of months. We don't have the hospitalization rate as predicted by the projections. If we go by the projections, we'll be over 400-500 people with COVID-19 positive that's in the hospital. Right now, our
eliminated the projections. What would be a basis of study that would provide security both to the people and the community, provide security to moving forward on some economic initiatives and opening up the whole bit?
I think the uniqueness to Guam is that you have to focus on the data that we have right now. There's nothing like this that we've experienced across the country.
I know, that's what I'm asking.
So I think the key here is look at our own hospitalization rate. Look at the rate of testing that we've done. The testing capacity is important. If the Navy can test 5,000 people of their sailors in 2 weeks, why can't Guam or the Navy help us test 5,000 people in a community? The testing capacity, if it's there, let's do that. If the rate of rise for our infectious COVID-19 is low, then we can create our own model. I think each of us can create. We can't compare to Puerto Rico. Puerto Rico has 4 million people. So I think there are in the adjustment as far as there it goes. But for Guam, I think you got to look at the local data and make our own projections going forward.
Okay. Mr. San Nicolas.
Again, thank you so much, Mr. Chairman. And as you know, I've always focused my advocacy, particularly during this crisis, on just making sure the territories are included. Just keep us included, and as long as we're included, that's already going to be above and beyond in terms of where we've been in the past. And I wanted to again thank you and thank our senior leadership for making sure that we have been included. And that brings me, though, Mr. Chairman, to my point with respect to the committee. Guam is receiving a record amount of federal dollars in order to be able to address the impacts of this COVID-19 situation. In order for our territories to be able to maintain the reputation necessary for us to be able to avail of these kind of resources in the future, it's important for us to make sure that we get the spending right when it comes to the utilization of these federal dollars. And at this time, Mr. Chairman, I would like to ask if the committee could consider more of an oversight role with respect to how these monies are being deployed in the territories. I know the monies come from various sources. They come from appropriations, ways and means, energy and commerce, a small business, financial services. But when it comes to the administration of the territories, that falls under us here at Natural Resources. And if our territories don't get the administration of these federal dollars right from the get-go, the outcome of any misspending could impact our impact us reputationally and have difficulties in the future. And so I know that Dr. Shea mentioned the need for transparency locally. I know that our colleague from Puerto Rico mentioned the need for transparency locally and the way the local government is administering the funds. We have a problem back on Guam, Mr. Chairman. There is a transparency issue. The governor is not being responsive even to local lawmakers. It's even been publicly stated by the governor that she does not need to answer to local lawmakers with respect to how she's spending these federal dollars. And they're at a point now where even the media is having to use Freedom of Information Act requests in order to just get basic answers. And then even those basic answers are being put off by the request for an extension, or even the statement that that comes out from the Freedom of Information Act being very contrary to what's already been publicly known. And so I need to beg the indulgence of the committee to help us find a solution on how we can, with our plenary responsibility here in Congress for the territories, ensure that these federal dollars going into our territories are going to be administered the way they need to be. And so I wanted to, I guess, yield to my colleague from Puerto Rico, our panelist from Puerto Rico, to if he wants to elaborate on some of his transparency concerns, and then also follow up with Dr. Shea if he would like to elaborate on some of his transparency concerns.
Thank you, Congressman. You're totally. Oh, wait. Yeah, am I on? Yeah. Thank you, Congressman. Totally correct. Puerto Rico, had basically a revolt in the last summer, 2019, because of the lack of transparency issues, and we peacefully marched, and the governor had to resign. Unfortunately, the current governor, as I mentioned with the education program, basically isn't being transparent. But we also have issues with our fiscal control board, which was imposed by the previous leadership of this committee. Because of our unique tax status, the $1,200 checks need to be a block grant to our Hacienda Department of Treasury. And then we need to submit a plan and guidelines that need to be approved by Treasury. Treasury hasn't approved those guidelines yet. The $1,200 checks haven't arrived. So the local government created a $500 check local stimulus, but the board, the fiscal board mandated by this committee is telling the governor she can't send over those checks until the $1,200 checks get to Puerto Rico. But again, our lockdown started on March 15th, and people are waiting too long. And we are still waiting for $20 billion to get there from the hurricane. And obviously, all those dollars require transparency. So we need radical transparency. We need Congress to provide oversight, and obviously to compel the government to act according to the law.
Dr. Shea, if you wanted to add.
Dr. Shea?
Yes, thank you, Congressman. Transparency, like I said, is very important. For example, our doctors and nurses, over the last 2 months, we had to go out and ask for donations for supplies, for face masks, for PPEs. Doctors and nurses, we should be focused, not asking for donations. We should be asking ourselves that question. The supplies should be provided by the government. For example, FEMA. We've asked FEMA to let us know what supplies do you have, what PPEs, what masks, what do you have? Let us know the amount so that if we do get donations, we don't duplicate what you already have. The answer we got is that, those are, above our pay grade, or, hey, that's not information that we shared with the public, etc. Those are not transparent. So if FEMA is here on Guam right now, if they have container loads, make that public, because we need to know what's in there and what supplies are being. Don't tell us that, with the hospital, if you have zero supplies, then come and ask us. That's not right. if our supplies are down to 30 days, supply us with what you got, but don't hide those information from the public. As far as the governor's office goes, I think she has openly told the senators that she does not need to inform how the federal monies are being spent. I think that's wrong. I think a transparent government is what we want, and without transparency, there really is no trust in the leadership. So I think as the federal money comes in, every dollar of the 128 million or more, if we get any more, that every dollar should be accounted for, and that should be made public so that we know exactly how this government is spending their money. So I think that's all I have to add as far as transparency goes, but we should demand transparency. Absolutely.
Thank you. Let me very generally, Mr. San Nicolas, and to the folks that just spoke. One of the frustrations of distance governance, which we're doing right now via online and virtual, is the fact that the very important function of the House of Representatives, which is oversight and accountability, can't play fully out. And you hear about what happened to the small business and the payroll paycheck protection plan, who got the money, who didn't, and mom and pops and independents are still waiting. You hear it about the distribution of masks. You hear about from Indian countries, they're still waiting in mainland to receive the support that they need to fight the pandemic. And so, you know, I think accountability is something we need to stress. And in the areas of jurisdiction in which we have very direct jurisdiction, not only a plenary, but responsibility, Mr. San Nicolas pointed out, we should. And we need to, because that's the only way. Trillions of dollars are being spent. And there was the intention of the legislation is a good one. I don't trust this administration to do it equitably and fairly. I'll be blunt about that. And so the role of accountability by this House of Representatives is paramount. And the other area of jurisdiction is Indian country. Other area of jurisdiction is obviously the territories and the discussion today. And I think we need to take them seriously. And whether the format is online or whether at some point we're able to do that collectively as a committee, we need to. And if it ends up being online, we need to, and holding people accountable as to how the money was spent, because it's the greater public good that the intention of this money was. It wasn't meant as a supplement to supplant what a local budget should be doing, and it was meant to take care of those immediate relief needs before we even talk about recovery. And if it's not being used for those relief, if it isn't being used to build up capacity, and if it's not being used to test the maximum amount of people that is possible in order to get a good reading on when and how we reintroduce stability and normalcy, whatever that might be, into our communities, then it's not being used correctly. It's not being used right. And that's going to be a responsibility that I take seriously, and I know the committee chairs of all the subcommittees take as well. So, yeah, we need to pursue that. Is mechanism now? Do we do it online or do we do it in person? Either way, I would prefer in person, but I think it's going to end up being online pretty soon.
Thank you, Mr.
May I add something to that, Mr. Chairman?
Please.
Yeah, I guess recently there was an article in one of the Hill papers about the absence of attention to to the insular areas by the federal government. Mr. Dominich came out in today's an op-ed opinion today saying that no, all of the insular government's needs are being met, which is true, untrue, period. Never has been true. And you know, I'm one of those, Mr. Chairman, you know me very well, that I have always said that Interior, is advocacy for the insular areas is not something that should be a badge of honor for the Department of Interior.
Absolutely
not. But and so I mean, nobody asked the Assistant Secretary Dominich to do an op-ed. I guess he has to because he's got nothing better to do. But it's never his money going to the insular areas is never sufficient for And number one, number two, we very much appreciate it. But it's not like everything is hunky-dory. It's not. It's just my 2 cents.
Adam, if I may ask you, how much time is left on our
We
prepaid
have
time on
20
this?
minutes left.
Huh?
We have 20 minutes left.
Okay. Mr. Sablan, let me thank the panelists. I have to remove myself because I have a pending appointment in my other part of my backyard right now with the staff on another call. I apologize for leaving. 2 things I want to add, and then if I may turn over the meeting to my colleagues to continue. That on schedule prior to the pandemic were some things. And one of them was the whole discussion we're going to have in terms of Puerto Rico on Promesa. The whole discussion was necessary in terms of some of the sovereignty questions around territories, the whole issue that was being asked in terms of the match for Medicaid, and related issues. And the pandemic hit, everything suspended, and those valuable oversight discussions and change of direction in terms of policy haven't occurred. They still need to occur. That's part of the backlog that we're facing, and we need to address it, and we need to address it quickly. But I think right now it's the relief and the response to this capacity issue, but understanding, I think that we're going to have to redefine recovery for all of us. And in this instance, in particular, in this discussion to the territories, what are we going to look like when we say we've recovered? What are going to be the systemic policies that are in place that change the relationship? How are we going to look at disparate treatment and equity in terms of resources and attention? Because I think that one of the things learned is the lack of preparedness. Some people might argue that in terms of the federal government to this pandemic, its inability to react, and the lack of resources for public health, the lack of resources in terms of stockpile for medical equipment, the lack of a planning and strategy to deal with a pandemic and a virus of this nature. And so, this virus didn't care who it affected and how it affected, but it has transformed the way we look at things. And I think it applies to the territories as well. And I'm looking forward to what comprehensive steps we're going to take to make the recovery, the relationship different going forward. And I want to thank all of you on the panel for your very valuable information and input, and to my 2 colleagues for their advocacy, and looking forward to working with them on what that comprehensive response, because it involves education, it involves SBA, it involves job training, it involves SSI, it involves all those things, because as the doctor knows, and all of you in the medical profession, good health involves many factors, and part of them is the economic and social factors as well. So I'm looking forward to it, and we'll try to continue to put as much urgency into it as we need to going forward. But thank you so much, and we will monitor in terms of the resources that are being applied to the territories at this point in real time, and press on the issues of Medicaid, the Medicaid match, and the SSI, because I think those are urgent ones that can provide some immediate economic relief to people. With that, thank you, Mr. Sablan. I appreciate it. To the panelists, Mr. San Nicolas, and sorry I have to scoot. I appreciate it. Thank you.
Thank you, Mr. Chairman.
Thank you.
Thank you, Mr. Chairman.
Yeah, Congressman San Nicolas, do you have something else?
Nothing. There's a lot, of course.
Yeah. Hey, you've got 20 minutes.
Well, our really big thing, and I think this is something that's being shared in all the territories, and it's what we talked about on our IRS call. I think IRS needs more support, because they only have one team that's working on 5 different territories that are in 3 different time zones, that speak up to 8 different languages, that have 3 different tax codes. if we want to make sure that the territories are going to be able to receive the resources from this first round and then future resources from any future rounds, IRS is going to need more than just one sharp team working, in 5 different, trying to have 5 different hats on. So I think that's something that I wanted to just kind of bring up. I also wanted to ask, because I know that a lot of the group here is more healthcare minded. Is there any specific healthcare resources that have not touched down, or that you don't foresee coming in, that you're desperately or urgently hoping are going to materialize?
I'd like to answer that question, please. So good evening again. Well, before I do that, I do want to make a correction in reference to the hurricane. I alluded to our category 5 in 2019. It's actually 2017. So I just really wanted to clarify that. One of the things that we're looking forward to right now is some of our testing supplies. We're trying to utilize the hologic RUO TMA assay. And so we're waiting for some of those equipment supplies to come in. And right now we're working with CDC as well as with FEMA for that, in particular to CDC. And so they're asking us more questions and we're providing the information to them, but we would also like to make sure that we receive that as soon as possible so that we can actually begin our mass testing as we are now beginning our phased approach to opening. One of the other things in reference to what we're going through now, and it's not medical per se, but we want to make sure that everyone takes into consideration that we're about a month away from a hurricane season. And so we have to not only look at COVID and dengue, because we're due for a dengue outbreak. So we have to take that into consideration. So COVID, dengue, and hurricane, the 3 combined would not, it would be detrimental to not just to our healthcare infrastructure, but again, to our economy as we are struggling as with everyone else. And upon that, I'd like to say that our funding is based basically on population size. And one of the things I'd like everyone who's negotiating for us to consider is basically our vulnerability in our population more so than the population itself. And of course, our demographic location and where we are. One of the things someone mentioned that they received some ventilators, and that's one of the items that we have been requesting. And we've been challenged as to the number of ventilators that's needed as a result of the current status of our healthcare infrastructure, the number of vents that we're using on a day-to-day basis. Because of our location, we're trying to get the supplies to our territory before we need it. We do not want to have them travel to us the day after it's needed, because it takes sometimes 72 hours when asked, when are we going to be able to get equipment and supplies? Well, it takes about 72 hours. That may be too late for us. So that's why I'm asking your support in getting those type of equipment supplies that we need to combat COVID. It's not just for COVID. Like I said, we are looking at dengue. Hemorrhagic dengue also causes a lot of hospitalization. So we're asking for your support from an overall standpoint. Thank you very much.
Yeah, that was your closing statement, Ms. Encarnacion?
I know we don't have that much time, and I really wanted to say, because I want to make sure that we're focusing on all the territories, and so I just really wanted to have an opportunity to say that. And also, I really wanted to take the opportunity to thank all of the Vice Chair Sablan, sir, and of course Congressman San Nicolas, and as well as Chairman Grijava. It's really an opportunity. This is the first time that I've actually done this. I know, Esther, you've done this before in the past. It's actually an excellent opportunity for me to be able to do this along with my colleagues. So I just wanted to give the opportunity to say thank you. And I look forward to working with each and every one of you. So I appreciate the opportunity that you've given the United States Virgin Islands. Again,
yeah, so Brian, anything you need, Brian should be able to give it to you. Federico, I think you're itching for something. Mr. De Jesus.
We
I have
appreciate
it on mute. I'm sorry. So right before coming on this broadcast, I was listening to radio online from Puerto Rico, and the radio DJ was saying that only 22 people in the government of Puerto Rico are currently in the health department are currently doing contact tracing. And obviously, with 1,400 positive cases, 22 people are not enough. I'm not aware, to be honest, because I just read it again. I just heard it before coming here. If there's any federal support to hire more tracers, but I think that supporting for tracing is key if we're going to reopen at some point, obviously. But without testing and tracing, obviously, we can't do that. So only 22 tracers for 1,400 cases without not enough tests in an island of 3.2 million is really laughable. So that's another area that we should focus on.
Yeah, you just got to over $2 billion, which is supposed to go towards COVID-19 related efforts or costs. Resources.
Well, but the congressman mentioned the transparency issue. So again, if this committee is serious about it, we need to look into it and require transparency. In fact,
right.
I would say.
You got more than some of the states, and which is a bit of contention here because you got 4 times more than the District of Columbia, and
that's right.
Did that, and you know, there's there has really been some back. That Speaker Pelosi in last week's caucus meeting had to step up and defend the territories because we did get $700 per capita and the states got $345, but she had to step up because some members were also asking why are the territories getting $700 per capita, and she I appreciated that she did stand up for us and put an end to that because she was getting phone calls about that. But yeah, Puerto Rico got over $2 billion for COVID-19 related expenses. The Northern Marianas got 34 or 36 million, Esther. Guam's got 111, 100, something like 17. That. And
we got 117, and then we added 8. I think we're over 120. So I think we're good. But again, transparency is so important. And if I can leave you with one of the final messages is that, you know, Guam is the tip of the spear for our military in the United States. We're very here near Asia, where the majority of conflicts with Korea and China is right next to us too. So never forget Guam. And the half-a-day spirit is where America's day begins. So I think we all got to work together. And Puerto Rico, I feel for you. 4 million people with COVID-19. We have 160,000 people here. So I think we're in better shape than Puerto Rico. But again, transparency, you got $2 billion. That's pretty darn good.
It is.
Congressman?
We just need to make sure it's spent right.
That's right.
Who was that? Was that Esther? Or
Yes.
Yeah.
I just want to say that, you know, the support that's provided to the territories, it is very critical. And I mentioned this at the fiscal summit the other day, is that, you know, we need to look at how the health systems in the territories, it needs to be a holistic approach of looking at it from prevention, you know, from hospital services and to responding to medical and public health emergencies. Those things need to be there all the time. It shouldn't be just when a pandemic happens. We need to be prepared all the time. So I hope that, you know, whatever funding is given to the territories, please keep in mind that it's not because, you know, we only have 2 COVID cases that are hospitalized. It's because we want to prevent, because our people are very, you know, we're not very populated here on the island. So we need to be very healthy. We need to protect our manamko, our children, and really protect everybody here. And whatever you can do, Congressman Nicolas and Congressman Sablan, whatever you all can do to strengthen us, that will be really, really appreciated. So, you know, that's all I want to close.
I apologize for breaking in. Our allotted time on this call is at an end. If everyone could please wrap up now, we have to end the event. Thank you all.
I agree with Esther. I think we can't always be crisis managing. That is not the way we do things. We got to be prepared.
Thank you, everyone. It's nice to see everybody.
Send us, if you have more to add, send it to us and we'll see what we can do. I'm not making promises, but we'll try.
All right, thank you.
Thank you.
Thank you.
I appreciate
the time.
it. Thank you.
Bye.
Bye.